Hi there, Dr. Connor here. So just want to touch base now on the define process. So this is the first step in your DMAIC process for quality improvement, DMAIC. So please make sure you check your QI roadmap. This is very important that you are following the process. This is what your faculty, all of us, are going to be talking to you about is how do you define the problem? What's the problem? What's the clinical issue that you are dealing with? And what team will you select to help you develop your project proposal around this problem? So it's really important to clearly define the problem, to understand what is the problem, who's involved, what people should be involved on a team to improve this. That's what we call stakeholders. So stakeholders are anyone who may be involved in helping to improve this process. Anyone who may be involved in what the problem is. So that can be patients, staff members, interprofessional folks. So physicians, providers, pharmacists, dietitians, infection control people, social workers, any number of people that may be involved in what your problem is, and if they have a stake, that's what we call stakeholders, people who have a stake in what you're doing, and do they have some part of what you're trying to improve? Because the worst thing you can do is to try to improve something on your own and not include anyone else, and then other people end up being unhappy with the fact that you didn't ask them their part of this process. How could they help with it? What do they think about what the improvements should be? So it's really important in terms of selecting your team, who should be on your team, who can help decide what is the best course of action to improve your problem. So that's why define is such an important part. You're defining the problem, you're defining what is it I'm going to work on, what is it I want to improve. Part of defining is even actually thinking about what's the ultimate outcome. What do I want to achieve? So you really have to put that together. What's the problem? What do I want to improve? Because all of that will lead to your measures, which comes later. That's the next step in DMAIC: define, measure, analyze, improve, and control. So in define, you're just beginning to think about what's the problem, who's involved, why is it important? This should be something that's really important to the organization. So, there are times where all of us have pet peeves, things that we think are a big problem and we wish we could fix. But you know what? If that's not a problem for the organization, if it doesn't contribute to something around improved patient outcomes, improved patient satisfaction, improved nurse satisfaction, if it doesn't contribute to something really significant, then we really don't want you to be focusing on something that the organization doesn't care about, that they don't want you to be doing. Let's face it, healthcare is a big business, and the expenses that go into this, everything that goes into healthcare, depends on what people do, how much time they spend on doing what they're doing. And so part of what you're doing in this process is you can't develop something that would take people away from their work, that would require many more resources and much more time and many more dollars to try to improve, because that's not going to fly. One of the things we want to try to teach you in this process is to work within the system that you're in, so that you have to understand what are the limitations of the budgets. How do we sort of work within those, but we still need to make quality improvements, and we need to try to make quality improvements that are evidence-based. What's the evidence? What's the best evidence out there that other places, other organizations have done to improve this problem, to work on this problem, and is there something we can do to make it where it's just not going to cost a lot more money for the organization, because that's typically not going to fly. So those are important things to think about. So also within the define portion, one of the first things you're going to do is to also, you have your PICO question, and you're going to begin to define and talk about the background. Why is this a problem? Why is it important to this organization, not just nationally? You can be working on something like, trying to reduce readmission rates for heart failure. Well, that's fine. That's a major issue nationally, but you have to also bring that down to how is that an issue on your unit in your area. So local as well as national significance, that's all goes into the background of what you're trying to do to improve something. And then of course, the whole idea is, where does this come from? What are the what we call triggers? There are problem triggers and there are knowledge triggers. So problem triggers are things that come about because they are problems within the organization, and that may arise from quality improvement type data, quality assurance data. That may arise from risk management data, infection control data, any number of places within the organization where there's defined data that say this is a problem. See, so that's what we call problem triggers. The other side is potentially knowledge triggers. In other words, maybe we haven't even defined that this is a major problem yet, but as a nurse, I've just read an article, a manuscript that demonstrated the significance of doing something very different for catheter-associated urinary tract infection, let's say, than we had thought about before, and we're not doing this. And I can look up and see there's more evidence around this. That's like a knowledge trigger. We haven't even figured out in this organization that this is a major problem, but if we figure out that there are other people doing things better in a more evidence-based fashion elsewhere, then maybe we should begin to think about that as well. So problem-focused triggers, knowledge-focused triggers, those are both the things that are really important there. Data is vital to this. One of the things we are trying to teach you is that you can't just go on gut feeling. It's not about anecdotal evidence of subjective. People said, well, I think this is a problem. I think we should do something about it. You have to be able to define and identify data. You have to be able to identify potential measures. What's the data? What are the measures? What kinds of things are we going to use to determine how significant the problem is right now, and to talk about what we think we can do to make it better, and then ultimately measure, did we make it better? And so the measures are so important in the beginning of this process, to be able to talk about the fact that, here's what we're going to measure, and here's what we know is currently happening. This is the data. These are the measures. This is what's currently going on, and it's a problem. We're not meeting benchmark. We're below national average. All kinds of things that you can possibly consider that are not meeting some criteria for how you should be performing. See, that's a big part of this idea. How are we performing? What's the performance of our organization, of our nurses on this unit? So you really want to think about what kind of data, what are the measures we can come up with, and that'll come later. But right now we're talking about define, and as you begin to define the problem, you also want to begin to think about what are the potential measures that we will use. So what's the problem? How big is it? How can we define it locally? What measures can we find that will tell us how much of a problem we have? I say all this because we've had students in the past that have began to work on projects they thought were very important, only to find out that it really wasn't a problem where they were working. So that doesn't help very well. We're not trying to do major research to contribute to general knowledge in the entire world. So what we say is, if you're trying to improve something in your area, it has to be a problem first before you can try to improve it. So Really want to focus on that, data and measurements, and then we'll get into the whole idea of cause. Root cause analysis will come up. Right now in the define phase, you don't have to determine what is the cause. You're trying to define the problem, and you're going to begin to think about how will we go to find root cause? What are the steps? What are the things that may be involved in the root cause of this potential problem? So we'll talk about that. And in the long run, for your define phase, you want to make sure all of this is feasible. Is this something, right now during this summer course, you're going to propose a project that we hope you or someone else will be able to conduct. We want you to be focusing on things that are vital to your organization, to your unit, to the patients you care for, to the families, to the stakeholders everywhere, the nurses, the physicians, everyone that's involved here. We want you to be focusing on potential improvement projects that can make a difference. That's what we really want you to do, is make a difference. And so, as you're beginning to think about this, but you also want to think, is this feasible? Sometimes we come up with problems, and then we come up with potential solutions that may take a year or two, to happen. So, you really don't want that. You want something that you think can be feasible. Fortunately, because the summer semester is so short for this course, you don't have to actually implement the project, because that would be very difficult to develop the project idea, get it approved, understand everything you're going to do about measurements pre and post intervention, and then implement and then try to get results. That's we've realized pretty unrealistic. So in this regard, we want you to think about things that you can propose a project that will be feasible, that will be something that hopefully you can do. But even if you don't do, if you propose it, and then other people, your nurse manager, other nurses, educators, other people, quality improvement people, take hold of this and say, wow, this is something that really needs to be done. If I were you right now as a student, I would want to come up with something that would be so powerful, so magnetic that, wow, we have to get this done. The good news for you is you don't have to do it this summer. You just have to make, what we're trying to get you to do is to make a great project proposal. We want you to understand the whole process of how you develop this wonderful proposal that you actually begin to sell to other people as, this is why this is so important and this has to be done. So it's sort of almost a marketing sales pitch, but it's also something that's so focused on quality improvement for improving patient care, hopefully improving nurse satisfaction, hopefully improving anything within the organization that helps potentially improve health outcomes. Okay? Hope you enjoyed that. Thanks for listening, and we'll talk to you again soon.